Good afternoon. I'd like to thank everyone for coming to Health and Human Service meeting. Madam Clerk.
Commissioner Baker McCormick, Commissioner Marecki, Commissioner Anderson has requested an excuse. Commissioner Killeen, Chair Scott,
Present.
you have a quorum present.
Thank you. Next item, please.
B, Chairwoman's remarks.
You know what? And I left them on the thing. But tomorrow is Sojourner Truth's birthday. It's a holiday for the state of Michigan. Most people do not know that. But I authored a double bill, Juneteenth. It's Senate Bill 384. You can look it up. She died here in the state of Michigan in Grand Rapids. And here was a woman who had paved the way for all of us, especially women. This woman was the person I was going to read the bill. All over, she has done things, just strong, standing up tall, These are women like that I love these women. They're strong, and it has allowed me to continue to stand up and fight. So I'm just grateful, Yes, I am. Thank you. I'm grateful because, we're put on this earth to serve people. And if you serve people, the good Lord will serve you. And he has served me well over these 60-some years or more. But I mean 60 in politics, okay? I served, I had my 90th birthday, okay? And it was awesome. And I just thank God for it. Well, I don't know if you are. Let me see. I need some glasses to read it now. All right. Well, since Juneteenth is passed, but anyway, Governor Granholm signed into law in the 93rd legislature. It was these were the people that helped me with this bill. Introduced by me, signed by Shower. Now, she lived in his state, but Shower was never able to do it. But God allowed me to do it for her. Gashka, who was a Republican. Thomas, that was Buzz Thomas. Brader from Ann Arbor. Clark from Mac and Bewick. Switowski from Warren. Jacobs from, what was that? She was off of Woodward, just north. She was a Democrat. And Clark Coleman. Hardeman, who was a Republican. He was a Black Republican from Grand Rapids. Basham, who used to serve with us. Cherry, who lived near Flint. And Oshovey, who lived in Warren. Those were the people that made it possible for me to have Senate Bill 384 enrolled. It was, yes, indeed. I'm just grateful because I always say you can't do anything by yourself. It takes all of us to work together. Okay, I won't read the Juneteenth part. I'll do that come June. This is a holiday, but it was not a paid holiday. And that's why it was done on a Saturday as opposed to, but hers was done on her birthday. Tomorrow is Sojourner Truth's birthday. So all of you thank her on her birthday and wish her a happy birthday, wherever God put her. The legislature recognizes the fundamental contributions Sojourner Truth made to the cause of abolition of slavery and the establishment of equal rights for women and to several other significant social reforms and human justice movement in the 19th century. Truth toured the nation for over 40 years as a forceful and passionate advocate for the disposed, using her quick wit and fearless tongue to deliver her message of equality and justice. She lived in Battle Creek, Michigan from 1857 until her death on November 26, 1883. Empowered by her religious faith, the former slave worked tirelessly for many years to transform national attitudes and institutions. According to Neil Painter, Princeton professor and truth biographer, no other woman who had gone through the ordeal of slavery managed to survive with sufficient strength and poise and self-confidence to become a public presence over the long-term designating Sojourner Truth Day in the state of Michigan. Will not only acknowledge the importance of her national figure in the anti-slavery and human justice movement, but will also recognize her strong ties to the state during her 26 years of residence here. In recognition of this great woman, the legislature declares November 26th of each year to be known as Sojourner Truth Day. All right, you all, that's it. Just lets you know you can do anything, all right? This strong woman during slavery. Woo. All right, back to the order of the day. Thank you all for listening.
Moving to C, approval of the November 13th, 2025 meeting minutes.
It's been moved and supported. All in favor? Aye, aye, aye. Motion carries. Next item, please.
D, unfinished business. There is none listed.
Thank you.
Moving
item.
to new business item 1, requesting commission approval of amendment 1 to a 3-year subrecipient contract with 2 one-year options to renew with the Arab Community Center for Economic and Social Services to continue providing the special supplemental nutrition program for the Women, Infants, and Children program services to high-risk, low-income women and children in the county.
All right, thank you all for being here.
Thank you.
you.
Good afternoon, commissioners. I am Dr. Brianna Osorio, Director of Public Health Division.
Dr. Altador, Ronald Altador, Deputy Director for Public Health.
All right, thank you, doctors. Go ahead.
Okay, good.
Yeah, so basically, this is an extension for an amendment, basically for access for 1-year amendment. So we already have a contract in place, so we're just extending for 1 year additional. Yeah.
All right, are there any questions? Thank you, Commissioner Marecki, and then Commissioner Killeen.
Thank you, Madam Chair. So why is this retroactive?
Go ahead.
So basically, with all the information that were needed, the documentation for all the processes, while we were submitting everything on time, we found out like there were certain key documents that were expired, like the FEP. So we had to go back to them, and that takes some delay and some time for them to obtain this particular documentation that were needed, basically, to move forward.
Okay, so
Yeah.
this is just for 1 more year?
Correct.
Yeah.
Can you do another one after this? Or do you?
Yes.
Yes, I
Yes,
think
we
it's
have,
1 to 2 years. Yeah.
yeah, we have
correct.
one more. We have the ability to have one more. So just with funding, and we just want to definitely be able to evaluate and make sure that we have everything correctly moving forward with our subcontractors.
Okay, so next time it probably won't be retroactive.
No,
Okay.
no,
Sounds good.
will not be.
Right, thank you.
All right, is that it with you? Anything else?
No.
No,
thank
okay.
you.
Then Commissioner Killeen.
Thank you, Madam Chair. Good afternoon. How much do the federal government kick into WIC?
So they have, they fund us at 3.125 million for this year for fiscal year 26. So,
So the total cost for providing WIC for the county is,
we our majority of all fully funded, well, I would say almost 100% fully funded from the state. And there's just some additional general funds, but we are a total of probably about 3 point, yeah,
Yeah.
no, about 3.5, about 3.5, yes.
Million?
Yeah.
About the same that the feds kick in.
Yeah, yeah.
Does the state kick in anything?
No, it's 100% pass through from the federal.
So what are we hearing about continued WIC funding coming out of DC? I
So
was surprised to see this, actually.
yeah. So at this time, we are funded through the fiscal year. So that is like that's the latest that we do know of. So there was some back and forth, of course, throughout the past couple of months. But at this time, we are expected to be fully funded throughout the year.
Whose fiscal year?
This is our fiscal year.
Our fiscal year.
Yes,
Correct.
yes, our
So
fiscal
we
year.
think we're fully funded through September.
Through September 30th, yes.
Because Congress is going to be staring down in January another
If there are any.
shutdown bill, I could say.
Yes.
Let's call it budget reconciliation, so nobody knows what the hell we're talking about.
Yeah.
Could the funding be imperiled there?
Hopefully not. We are trusting that it'll be funded till September 30th. If there is anything different, they have agreed to make sure that we are in the know, so that way we can plan accordingly.
Right.
Yeah,
So the answer is yes, it could potentially be. Funding for this could potentially be in danger, even though we've been told you're funded
Yeah.
through September 30 of 26. That could change.
it says it's funded through, I'm just gonna stick with it. It says it's funded through the fiscal year for September 30th. So,
We'll
We're
keep
gonna
a
have to be on
positive
our-
note of it.
yes,
We're gonna have to be on our P's and Q's about this.
yes, we are. Yes, we
Answer
are.
is yes. Good.
The answer is yes.
I mean, even before it was the same case, like these fundings are, you can pull this funding at any moment.
Yeah, yeah,
So,
yeah.
Yeah.
Alrighty. Thank you, Madam Chair.
Okay, you're welcome. Commissioner McCormick?
Thank you, Madam Chair. And I was trying to recall the issue that we had with our numbers. We had how many locations? Let me just, that we service WIC.
Yes. So I'm just thinking in my head too.
Mhm.
I know we used to have 11. Now I believe we have 1, 2, 3, 4,
8
5, 6,
locations.
yeah, 8 locations. Yeah.
Okay. So when did it decrease?
So periodically throughout the time after COVID, that was where our numbers started to decrease, but now we are actually increasing our numbers. So
Back
we,
up.
yep, we are heading back in the right direction. So we are getting closer and closer to what the state is also requiring us to take on to that caseload. So that has been one of the things that we've been working closely with the state. They have also done their own RFP with some of our former subcontractors, and they are also helping take on the caseload for Outwayne County. So that way we're able to provide services across the county for all of our families that are enrolled in the WIC program.
Okay, so we're still not yet caught up with the number of requests, I guess?
Yeah,
or-
we are still seeing all of our clients that do get enrolled in the program. It's just meeting that time within the time span that's required of 10 days or 20 days based upon the cases. So we've been just making sure that we are trying to reach those goals. And that's where, we had been out of
Running.
compliance before. And so we have always been able to see them. It's just not within the time span that has been required. So we've been increasing that. And so we are getting much, much closer in compliance. And the state, when they came in, they were like, you guys have done everything possible to
get
make sure
there.
to get there. So they're definitely having our backing on that as well.
So we're looking at opening how many more locations to get there?
Well, right now, we are trying to make sure that we sustain what the locations that we currently have.
Okay.
We are looking at just building on renovations to have more accessibility at our Hamtramck location. So we just had like one office. So now we're just building out the capacity within the locations that we do have to see more clients. So that
Definitely.
tends to help us actually meet those numbers.
And how many clients do we have currently?
We have over, I want to say we have about 16,000. Yep.
caseload. But, yeah, we are like, getting
We arranged to get
14.
to about the 18. Yep.
And they can stay on WIC. Is there like a time span from, I don't know, from the child's birth till
Yeah, 5,
2 or 5?
usually, yeah, there is like some eligibility criteria.
Right.
Yeah, it can go up to 5,
5
years
years.
old,
yeah.
Okay. Thank you.
No
definitely.
problem.
Okay, Co- Commissioner Marecki and then Commissioner Khalid.
Thank you, Madam Chair. Wait, I just want to clarify something Commissioner Kleen was talking about. We get 3.1 from the feds as a pass-through,
Yes, yes,
but the whole program is 3.5.
yes.
So
yes,
we're just putting in the other, or whatever it is.
Yes.
Yeah.
We're
we
just
have for
putting in the
general-
remainder, but, okay,
Yep,
all right,
yep.
thank you. Thank you.
Is that it?
Yeah, thank you.
Okay, you're welcome. Commissioner Khalid?
Yeah, thank you, Madam Chair, for recognizing me one more time.
Sure.
Are we, at the WIC centers, are we putting out information on RX Kids for these young families to make them aware that if they're in one of the 6 communities, this is available to them?
That's a very good.
That's a
question.
very good question. So one of the things that we kind of put a lot of emphasis on is making sure that across Wayne County, all programs, they communicate and exchange and operate together. So RX, like we are aware of, like the RX starting,
Yeah.
and definitely we'll do our best to basically make sure that this information is passed on. in the
Okay, good.
week.
I thought,
Yeah,
as I was sitting there, I thought, that'd be another good opportunity to
Yeah.
get
That
the
is-
people we're trying to
is.
serve.
that
Yeah.
is.
And that is, yeah, and as he said, we tend to look for making sure that our current programs are also promoting a lot of the new services that we're providing out of HHVS.
Thank you. Thank you,
And
Madam Chair.
Chair, to that point, so
Commissioner McCormick? go
thank
ahead.
you. Vision to Learn and all of the other,
Mm-hmm.
so you're incorporating that information, or are you doing something separate with
Yeah,
clients?
Vision to Learn. Yep. I
Yeah,
would
the
say-
age group is different.
Yeah.
You're talking about a different age group. So, yeah, which may not, so the overlap is very like, it's not a lot, like in terms of like the clientele you'll be seeing.
Yes.
So they kind of vary apart for Vision to Learn and Week. Because Week basically like the first year, couple years focusing. So yeah, so I think that it's very important, and we do recognize that we need to bring all program together. It's one Wayne County, and the difficulties, like some program, they have specific criteria in terms of like eligibility. Certain group may be included and other group may not be included. But where we do see the needs, where we can bring program together and different resources together, we definitely do it because it's more efficient, less resources, less staffing, less money spending, and better result.
Thank you.
All right. Yeah, Commissioner Wilson?
Thank you. Thank you, Madam Chair. Just a quick question, maybe rhetorical, but this benefit does not include the city of Detroit. Is that correct?
Right. So we do
They're separate
see.
and apart
Yep,
from,
they are, the city of Detroit also has their program as
Okay.
well, but, we definitely don't ever turn anybody around, even if their address doesn't, sit within our jurisdiction. But we will definitely recommend, hey, this is location, and then we'll do the referrals from there as well. So we all work out of the same, state, program as well, where we get all of our clients.
thank you. Final inquiry, if I could, Madam Chair, through the chair.
Sure.
The firm Arab Community Center for Economic and Social Services based out of
Dearborn. Yep,
Dearborn.
that's
It's,
access.
it's, pardon me?
It's access, yeah,
Okay, so
Yeah.
it's based out of Dearborn.
yes.
Correct.
This is just to maybe be a silly question, but it's out of Dearborn. I mean, is there a reason why it's based out of Dearborn and it covers the entire county?
Yes, so,
Devoid of Detroit, of course.
yeah,
Sure.
well, you gotta understand the location is key. So Dearborn, we have a huge community out there of WIC
Yeah.
that we are just servicing, and we need definitely this partnership with Access in order for us to provide the services.
Yeah.
And you gotta understand, like, we have a very diverse community out there, and Access, but for a long time, they've been building on this community. They have strong tie. So yes,
That's only one of our
Yeah.
locations,
That
so,
was my.
yeah, it's
Yeah.
only one of
Just
our
read my
locations.
mind.
Yep.
Yeah.
There are other
We have,
locations.
yeah, we have our,
There-
yep,
Garden
Sumter Township?
City,
yep.
yes,
Ta-
Hamtramck,
Okay, so,
Taylor.
but this is the biggest
Wayne.
one you're saying, the most,
Yes, ma'am.
This
Yes,
is one of our bigger,
One of-
this is one of our bigger locations, yep.
okay.
Yep.
Thank you, appreciate it.
No problem.
definitely.
Yeah, you're welcome. Okay. That's it. Thank you all, and I have a motion and support.
Go ahead. We have an addenda. Oh, you do. Sorry.
We need,
Yep,
need a
yep,
motion
yep.
for approval.
That's fine. Yeah.
Somebody wants,
I'll do it. I'll make an approval.
I'll support that.
Already. Been, been moved by Commissioner Mareki, supported by Commissioner Khalil. All in favor?
Aye.
Any opposes? Hearing none, motion carried. Thank you. Next item, Madam Clerk.
Moving to the addenda, item 2,
All right.
communication from the Department of Health, Human and Veteran Services, forwarding a report on the medical insurance reimbursements redirected to Medicaid for inpatient hospital services for patients registered as Wayne County Jail inmates in fiscal years 2022-23 and 2023-24.
Thank you.
Good afternoon, everyone.
Good afternoon.
This report was to be presented by Director Ebony McCann, but many of you may know that her husband did recently pass away, and so she is out on bereavement leave.
Sorry to hear that.
Yeah, so I am Keneal Johnson, Director of the Department of Health, Human and Veteran Services, and with me today to present the report is Dr. Keith. This report was submitted to you all, and it does provide information on the medical insurance reimbursements that were redirected to Medicaid for inpatient hospital services for patients registered as Wayne County Jail inmates. And so this was done for fiscal year 2022 to 23, and then 23 to 24. And so Dr. Keith will provide an update on the data that was submitted to you all.
All right, Dr. Keith, you're on.
Right. Good afternoon. Good afternoon, everybody. Keith Dugokensky, Department of Health, Human and Veteran Services, Transition Services, Jail Health. Just as you heard Director say, this report advises with regard to the charges that are associated with those inmates that we service at the jail that need to go off-site for a higher level of care, in this case, particularly inpatient care. And about 15, 18 years ago, Medicaid has allowed inmates that go off-site for inpatient care to have a benefit, and we take advantage of that benefit and redirect those charges to Medicaid so they do not fall on the county general fund. So you see here the dollars for fiscal years 22, 23 and for 23, 24. And those are the charges for the inpatient care that were redirected to Medicaid, therefore not needing to be paid by the county, and saving, of course, the county general fund those dollars.
Okay. Any questions? Commissioner Khalil?
Thank you, Madam Chair. And going back in time a little bit, we made a big push, and I forget which year, to get people in our custody signed up for Medicaid. Because you said like 15 years ago, the Fed said it was okay, but we didn't have everybody signed up on it. Correct. So just to round this out, because we were spending a ton of money on people leaving the jail to go to the hospital. So what year did we really start making the push to make sure everybody that was eligible in our custody was on Medicaid?
So we have been doing this for probably close to 15 years when the benefit became eligible, right? So we had started right from when the guideline had changed to allow inmates access to an inpatient benefit. So we've been doing it for the entire time.
15 years flies by, so I
Right.
didn't think it was that long ago.
Yeah.
So, just to round it out then, you gave us the numbers here, 6 million for fiscal year before. What is the total bill that Medicaid doesn't cover? And I guess that would be a cost that would come back on to the county. So having people signed up for Medicaid is, 6 million, whatever. What are the total costs of people leaving the jail and going out and getting medical services? I don't think we're covering them all here, right?
So all the inpatients that leave the jail and go out for inpatient care are covered here. We're
Oh, they
very
are.
judicious and diligent about making sure that everyone is covered. One of the things that had happened, as you know, was Medicaid expansion.
Yep.
And with Medicaid expansion, we really benefited because now there was a very smaller proportion of people that did not have Medicaid coverage.
Yeah.
So we didn't have to go through all the legwork and potential risk of signing people up and missing that cohort of people. So now the 95% majority of people are all signed up for Medicaid and they have the benefit in place. So we don't have to do, as you referred to, that extra step of signing people up since Medicaid expansion. And that has simplified, if you will, accessing this benefit for us.
Because that got a lot of people coverage
That's
when that
correct.
happened. Maybe
Yeah.
that's what I'm remembering. What, just for reference, what did we used to pay out every year? Because now we're not paying out much at all because everyone's covered. Before that was happening, there were some pretty large numbers.
There were some large numbers. I don't know exactly what those numbers are, but we were essentially paying for all of this
Right.
prior to the existence of the Medicaid inpatient benefit. So all of that would have been coming on the tab of, jail health in one way or another. But again, this has been in place for 15 plus years, and we have been making sure that we take advantage of this, redirecting the hospitals to bill Medicaid directly and have that charge not fall to us here in the county.
Thank you very much. Thank you, Madam Chair.
Thank you. Anyone else? All right. Thank you.
Thank you.
Okay. Can I have a motion on this, please? Or should we do all?
Yes.
We can do all three. Okay.
Moving to item 3. Communication from Brianna Osorio, Director, the Public Health Division, Health, Human and Veteran Services Department, forwarding a report on the Michigan Department of Health and Human Services Local Stabilization Authority funding, including a comparative analysis on how the funds were utilized and spent for fiscal years 2022-23 and 2023-24.
All right. Thank you, Doctor. Go ahead.
Good afternoon again. Dr. Brianna Osorio, Director of Public Health Division. So this is just to provide a comparison report for our local stabilization funds that we get every year from the state. We are able to utilize those funds that are for a couple of our programs that are eligible for ELFIS funds. So that's just another grant. So that's usually we use these to support our staff supporting. So we have used some of the funds to provide additional staffing on our food safety unit under environmental health, which has really helped us just increase our capacity to take on the work that we do out of environmental health. for inspecting the different food establishments across Wayne County. And we have used this for different investments across public health for improving our health infrastructure. I will say, I mean, our technology infrastructure as well. So certain investments there. So that is the plan, to continue to utilize that to support our staff, as well as some of the very much needed software updates.
All right,
Yes.
thank you. Any questions? Commissioner Khalil?
Thank you, Madam Chair. Yeah, it was a blizzard of numbers,
I'm sorry, yes.
to say the least. So I just want to back up from the numbers for a minute.
Yeah.
MDHHS has a local stabilization authority
Yes,
fund.
yes,
Now, authority says to me that that's an independent with an appointed board. Are they separate from NDHHS or are they MDHHS employees?
they're MDHHS.
They are.
Yes, yes.
And what is the purpose and what's the discussion like on an annual basis for local stabilization?
So a lot of the times, if there's any funding deficits across any of our programs, this is an opportunity that you can be able to use these funds that come in consistently. And it'll also be anything that we don't use also rolls over. So it's really helpful for us to also have almost like that additional savings. If there's any needs that we have that come about, we can always tap into our local stabilization funds.
Okay.
Yeah.
Can you send us a little something on that? I'm sure it's not unlimited.
No, no, it's definitely not unlimited. You can only use it for certain programs
Yeah,
that are
like
eligible for it.
parameter. Yeah.
Yes, yes, not a problem.
But this is different than the annual MDHH grant,
Yes, this is different
the
from the
big anchor
comprehensive,
house.
yes, the CPB.
CBB, PG, whatever it is.
Yes,
This is separate.
yes, this is sent separately. So we receive our letter usually right around this
Yeah.
time for going ahead and certifying for these funds.
Yeah. So the CP, whatever,
Yeah.
that
yeah.
is when the state says we have funding for you to do local, in your local
Their local
community, state programs.
Yes, yes,
And this is different from that because this gets into our books
yes,
and we negotiate with the state, hey, we need help with this, we need help with that.
yes, yeah,
But it's not necessarily state programs.
no.
It's not probably at all.
So we use it just to, I mean, it's the same state programs that they still send us the money for
Oh, okay.
CPBC. So it's just where we can actually utilize that is a little restricted. So not all of the programs that come through CPBC can get that additional funding. So
Oh.
we just have to make sure that, it's still within those parameters that they give us. And it'll be something like, hey, if you need more staffing, just because a lot of the grants, can be very restrictive and that funding will also fluctuate from year to year. A lot of the times we know that this money will always come in. So like I have a few of our staff out of the food safety unit that we needed to open up positions that we could no longer afford before. Now that will also always be their salaries will always be funded out of here.
So the state has priorities, what they will and won't give additional funding for.
Yeah.
And I won't go through them all, but just out of curiosity, is lead abatement one that we could go through the authority for additional funding?
We do not have the lead abatement program anymore too, and we were also we were asked to not continue on with that grant too, because they were going to plan to end that. It was very expensive. There are a lot of different efforts that are coming out of the state to really support lead. And we continue to have our child lead poison and prevention program that still does lead testing. And then we also promote whatever additional services that will come out of the state too, to make sure that we collaborate with their municipalities to make sure they know that those resources are available.
Okay, yeah, because the housing stock in Wayne County is a very high percentage
Yes,
of lead paint in those homes.
yes,
So
yeah,
now the state is not giving us lead abatement grant anymore.
Yeah.
That
Yeah.
must have been in the last year or two that they,
it was, I think
Yeah.
right when I first
'Cause I was
started
shocked
too, that
when
was
you
like the
said-
last year. Yep. And they said it was about, it was
yeah,
the grant was just limited, and then the amount that it actually takes to do a lead abatement for one household was extremely expensive.
Yeah, and I think
So,
when we got the allocation, we were talking like, well, we can do 11 homes this year or something like that.
yeah.
So the
very few.
state has taken that back.
Yeah, they
And-
have been doing a lot more about promoting plumbing. And then there's a lot of power that has gone to municipalities in regards to making sure that they work with them, as well as we will step in to kind of provide that education about, hey, this
Yeah.
is, this is where your levels are in your municipalities, and then this is how you can kind of tackle those issues. So,
So is the state providing any abatement dollars now to go into people's homes? Okay. You got, it's like the Flint water thing. Okay, you got lead. Good luck. We test and we find out
they,
children get.
So, I mean, right now, what it is that we will make sure that we provide that support, where a lot of it is municipalities are making sure that their residents know it's more of a plumbing issue.
Yeah.
So a lot of that comes down to their areas and the municipalities where they'll be able to kind of work together on that. Like they'll work with Eagle, which is another state regulated program. So they all work with them on getting those numbers down. So,
Well, we already have this issue with local government being able to afford
yeah.
the lead lines that are
Yes.
supposed to be replaced, that the state of Michigan said you got to replace them.
Yes, yes.
So I think most of our municipalities are like on a 25-year plan, given the funding that's available. But separate from that, the lead that's in the homes,
Yeah.
in the paint, is the state providing any rehab funds for those, either directly from the state or through municipal government? Or are people just out of luck on
I'm
that?
not really sure. I'm not really sure on that. I would have to get
Yeah.
that. Yeah, I would get that answer for you. But I know that we have like our environmental health program
Yeah.
that also has the when they will come in with our nurse case managers,
Yeah,
and they will do a lot of that testing as well.
Yeah,
with
well,
the
I'm not,
paint,
the
so,
testing is one thing.
Yeah.
Right?
Yeah, but getting rid of, I understand
Yeah,
what you mean.
but really doing the abatement, something is better than nothing,
Yes.
and we were doing something,
Yeah.
or the
Yeah.
state was, the funding, but now it sounds like, no, we're not doing that anymore. Okay,
Yeah.
I know in
thank you,
Highland
Madam
Park,
Chair.
yeah, you're welcome. In Highland Park, they're redoing all the underground,
Service
yeah,
line.
service lines, yeah.
Yeah.
Well, all municipalities are supposed to be doing that now,
A lot of them
Yeah,
are.
they
Yeah.
probably are.
but
Yeah.
the funding is the thing. Try to replace all those lines across city Detroit, right?
Yeah,
It would bankrupt the budget if they did it all in one year.
yeah,
So, all right.
Yes, it's true.
Thank you.
You're welcome.
yes. Thank you so much. And we have Dr. Shake online that wishes to speak at this time.
Hi, everyone. Dr. Sheth, Chief Medical Officer, HHVS. I just wanted to just chime in on the local stabilization programs. They're specifically supporting our essential local public health service programs. So these are mandated, required, kind of essential core public health services. And local stabilization can be utilized for those programs specifically. So we're talking about Director Osorio Eccleston, mentioned food, so food, hearing and vision, communicable disease, infectious disease, immunizations. So those core mandated services, those are only the programs that qualify for this bucket of funding.
Okay. You have any questions of her? No, okay. Thank you, doctor. Okay. Next item.
Item 4, communication from Rachel Davis, Director of the Department of Juvenile and Youth Services, forwarding a report for the Youth Assistance Program yearly outcome, comparing the results from fiscal year 2023 to 24 to fiscal year 2024 to 25.
All right. Good afternoon, Dr. Davis. Oh, right, you're not. Okay, I should have said Director Davis. Okay, yeah. Yeah.
Would you turn your mic on? Thank you.
Director Rachel Davis, Juvenile and Youth Services Department.
Good afternoon to this honorable board. Nathaniel McQueen, Chief Program Officer for Juvenile Youth Services.
Thank you, Ms. McQueen.
Okay, we're here submitting the YAP Annual Outcome Report. YAP is a short-term prevention program for at-risk youth to support their personal and academic goals. During fiscal year 2025, we serviced 801 youth participants in the program. We've got 9 providers in fiscal year 2025. The funds come from Wayne County millage funds and general fund dollars and offers countywide programming.
Okay. Any questions to Dr. Avis and Mr. McQueen?
You a good boss.
I have to go back to school.
Thank you for being here today. The out of the 801 that were served, the academic portion of this, how many graduates do we have?
I can get back with you because they receive different types of services, some academic, some mentoring, and others. I can tell you that out of the 801 youth that participated in the program and received various services, 76.3% were listed as successful in achieving their goals.
You said 76%.
6%.
Yeah, I'm not looking at that report, so. Okay, but we don't know how many actually graduated and finished.
I can investigate
Okay.
because
No problem if you don't have it. I'd like to know that. And what programming they have as well.
yes, we
in
do.
place.
We do have a chart. I'm not sure if you have that, but if
I don't have it in
if you
front of me.
don't,
Yeah.
we can get it to you.
Okay.
And it breaks down all of the youth assistant program providers and a list of their services that they offer.
Mhm.
And each youth gets something that's specific to what their needs are.
Okay. All right, yeah, I was just really interested in the graduation numbers. And the other thing, the number of youth that are needing specialized care. Do we have that number that are still at the juvenile detention center? Do you have any information on that today?
So the youth assistant program offers services to the youth that are in the community. So is there another?
Okay, so I'm off. That's another subject then.
Okay,
Okay, thank you.
no problem.
Anyone else? Thank you. Commissioner Killeen?
Thank you, Madam Chair. I like numbers, I like trends, I like graphs of all sorts. You've given us 2 years of data here. And I'd like to see a longer look at this because we've been doing YAP for a long time. In your summary report, the percent that didn't make goals in 23-24 was 18.2. In 24-25, it was 23.7. So I'm looking for longer term data to show, is this a trend that fewer are graduating? I guess that would be the term out of the program. And then I'm wondering, as I look at the data for all the individual YAP centers, is there some sort of a number? Like if 35% of your kids are not being successful, we have to look at what you're doing, or 50% is, how does that evaluation work as numbers for youth that don't complete the program successfully goes up? How do we evaluate these YAP centers then in terms of how services are being provided?
So to answer the first part of your question, as I understand it, I can investigate previous years, the comparison between previous years.
Yeah, I think just seeing some trend over time would be helpful.
Okay. And then the second part, this report was prepared before I became director, but one of the first things that I did look at is the percentage of successful youth across these charts. And I did notice, who was our highest success rate and who was the lowest success rate. And so for my personal awareness, I did want to investigate what are the differences between maybe what's being offered, or if there are any challenges or barriers to those particular providers that can maybe be moved out of the way, so that no matter what area or what YAP that is servicing youth, that the youth can receive a more similar level of success out of each. I have not had the opportunity to do that
Okay.
yet.
So we don't have anything in place like an annual review where we sit down with each one of the YAP providers and say, okay, this is your numbers this year.
To my understanding, we do that. Can you speak to that?
Yes, once again, Nathaniel McQueen, Chief Program Officer for Juvenile Youth Services. Yes, we do meet not just annually, but quite often with our youth assistance program providers. They are aware of the numbers that they do produce. We do make sure they have those metrics, and then anytime that we see that there is a slippage in that percentage, we do look at what means and what ways we can do to, like the director said, to remove barriers that may be causing that slippage.
Yeah.
So.
Have those efforts proved to be successful ongoing through the year?
This past fiscal year, yes, they have thus far.
Well, you've been around for a little while too, so, but that process is one that we currently do, is one that you find beneficial and helpful to getting more students across the line, more young people?
Yes, one of the things that we did implement was that there was kind of a yearly review with the potential youth assistance programs. We have now increased that to now it's quarterly. So now they have a better sense of exactly where they lie within their providing of services to our youth within the county.
Okay. Have we ever canceled a contract if we didn't think somebody was performing under YAP?
Not to my knowledge, no, we have not.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Mareki.
Thank you, Madam Chair. So we have a chart here, and it has the YAP providers and the yearly allocation, the contract budget, and county funding. Is it just the Conference of Western Wayne and Downriver Community Conference that get the 1/10 mil?
That is my understanding, yes.
So that is in a Wayne County across, so do you know why that is? I mean, what's the background of that? And you might, I know you're brand new.
Absolutely.
I know, I get it.
Some of this is CCF funded, which is the child care fund.
Okay.
And so that covers some of the funding there.
In the
CCF.
1/10 mil?
1/10 mil
Okay.
is totally different. Those communities have set aside monies to take care of the youth within those communities for that 1/10 mil.
So that's a child. Where is that 1/10 mil coming from? I mean,
Taxpayers, it's coming from the mill.
so it's only those communities that passed a tax for this?
I can investigate
Yeah.
how we came to that.
Because I thought everybody got the 1/10. I thought it was a Wayne County mill.
I think there may be separate money that's set aside for those based off of the 1/10 mil, but again, new to the position,
Yeah,
I can investigate how that was determined.
Yeah, I wouldn't even have known this if I hadn't seen this
Okay.
chart. So, okay, that would be great whenever you can do that, because, yeah, Felicia. Our corporation council's coming in.
Mr. Chair, if I'm not mistaken, that is actually required by our Wayne County ordinance. That requires that, and I can't tell you the rationale for why. But I'm fairly certain that there's an ordinance regarding the meal that requires a certain set aside that this body adopted many years ago.
So why would just the CWW and the Downriver community get the 1/10 of that?
I didn't bring my laptop. I'm pretty sure it mentions more than just those two. I'll print the ordinance and I'll
Okay.
circulate the language and I'll have to review it.
Okay,
Because it's like I said, it was before my time. I know there's an ordinance and I think it may mention more than just those two. I think it's all of the conferences.
yeah, this chart we have just has those two getting that. So, okay, that'd be great. Thank you.
Anyone else? All right, thank you very much. Now we can, vote on those three.
Thank you.
I mean, the two, yeah. Okay, it's been moved and supported. All in favor? All right, and I vote yes. Motion carried. Thank you. Next item, please.
Moving back to the agenda. F, such other matters as may be properly submitted before the committee.
I don't know of any.
G, public comments.
Anyone online?
There's no one on Zoom indicating that they would like to speak and no emails were received.
No one. Okay, thank you. Anyone in the audience? Yes. Go right ahead.
How long? Madam Chair,
What do we do?
1 or 2 minutes. It's at your discretion.
2 minutes,
You have 2 minutes.
45 seconds.
Okay.
My name is Carlton White. I'm a director over at North End Village nonprofit. We provide service to developmentally disabled, severely mentally ill members. Most of our funding comes from DWIN, but the main thing I wanted to let you all know today is I will be emailing you all. I kind of want to get the free services that we provide over at the Considine 8094 Woodward over in Detroit to all of your constituents. Outside of that, just wanted to thank you all for all the service you do. It's been very elating to find out what we're doing for the Wayne County as a whole. We service Romulus, Inkster, Detroit, and Highland Park, and we're actually looking to expand services. So look forward to working with you all in the future, but just want to let you know about our program.
Thank you so much. Yeah. Okay, anyone else? Anyone in the audience? Okay, thank you very much. Next item,
Adjournment.
been moved and supported.